Hi, I'm Hilary Struby,
Hi, I'm Wayne Struby.
and we're Family Acreage Health and Wellness.
There you go. But you got it before it went. All right. Okay. What are we here today for? What are we doing today?
So, we're going to talk about physical therapy and all the different aspects of physical therapy. So,
Yeah,
what do
yeah,
people usually, whenever you tell someone that you're a physical therapist, what is one thing that they do or say?
yeah. It's something I absolutely love. Whenever I tell somebody I'm a physical therapist, like, "Oh yeah, my neck hurts. Can you give me a massage?"
Yeah,
So,
massage. Right.
or
Oh, massage. That's so nice.
yeah, or somebody will say, I mean, nothing against massage therapists, but I didn't go get a doctorate in massage. We sometimes you'll run into somebody that's had a lot of therapy and they're like, oh my gosh, no, because they had a good therapist like Hilary and they're very specific and very, they won't let them get away with a bad form. So there's tons of different therapists. A lot of people usually think some type of orthopedic thing, but
Or
what,
pain
yeah,
related.
yeah, pain related. So Hilary, what are there? What kind of therapies? Or let's just start off at the top.
So we're just gonna go through just
Therapists, physical therapists can be anything. That's why school's so freaking long.
yeah,
It's
and
kind of like
and
a
it's
doctorate.
a big realm of things. Like you can do one thing for 2 years and switch and be completely different field
Yeah,
for the next 2 years.
yeah.
Um, so I'm just gonna start going down the list. We have pediatrics, and that can go from autism, cerebral palsy, to children's diabetes, to orthopedics within pediatrics
Yeah,
with sports injuries.
I've only treated one kid. He was like 3, ran out in front of a car one time, and it was terrible treating him. I don't want to do pediatrics. It was awful. You remember that kid? He would not sit still. He was just running around the clinic. His mom acted like it was a babysitter. It was awful. But for
So yeah, with pediatrics, you do have to have a lot of patience. Wayne isn't one that has a lot of patience with
for some
kids,
things,
especially other kids.
other people's
And
kids.
it's a very special tool because you have to deal with not just the kid as well as the parent and what they're going through, because they're going through something hard and tough, and they need that kind support from a therapist.
Yeah,
Not this one.
not me.
All right, and then you have geriatrics, which is the opposite realm of the spectrum, but you're working on with stroke, Parkinson's, just debility as a whole, because you're dealing with a lot of people with comorbidities. And
What's that?
comorbidities is multiple different diagnoses that causes
Yeah, usually have diabetes. They have blood pressure. They have, they have had a stroke. They have tons of different things.
a lot of things
COPD. Yeah,
going on, that it's not just one thing that you're working on, because you're working on the whole body, because the whole body's affected by it.
yeah. I like geriatrics. It was fun. I've treated home health, and we treated working at the rehab center. My problem is I talk too much, and I like to listen to stories, so I'll be in there for like an hour.
Yeah,
Just
but that's great
while away the hours.
when
Yeah.
you have a patient that has been through a lot and likes to tell their
Oh yeah.
story.
Oh yeah. You can learn a lot. It's like just shooting the breeze with somebody on the front porch.
Right.
Yeah.
Yeah. So, and with pediatrics and geriatrics both, you can do like home health, that includes it, and just like outpatient therapy, as well
Mm-hmm.
as hospital, like inpatient rehab or anything like that. So there's so many different realms. Even when you're just looking at one thing, there's so many
Oh
things
yeah.
within that one
Specialize in
thing.
stroke. You specialize in Parkinson's. I mean, geez. I
Yeah,
mean, yeah.
there's just so much. And what we were doing is we were working at a rehabilitation hospital, which is 3 hours of intense therapy every
Yeah.
day
The patient has to do it.
for 5 days out of the seven,
Or 7 days out
or
of seven.
7 days out of the seven.
Yeah.
And you get like an hour and a half of physical therapy, an hour and a half of occupational therapy.
Or sometimes I'll throw in an hour of speech if
Yeah,
they need
so
it.
if you needed speech, then you would have an hour of
Yep.
each therapy. So that's another realm, and within that rehabilitation hospital, there was an outpatient clinic, kind of working on some of the same things that you saw in inpatient, but maybe the aftermath.
And Hillary was one of the few that would do both. She would jump back and forth between them.
Yeah, and that's tough too, but that's, it's good because you get your, fresh in different places.
Yeah.
You have acute care, which is mainly just in the hospital. Those couple days
right
that
after
you stay in the
surgery,
hospital, they want to get you up, get you moving, get your blood circulating.
There's even more acute than that. I heard somebody said they're in the ER. They had a therapist in the ER. I don't know how it works.
Yeah, I believe it.
But I know that a couple of our friends, they work at urgent care, and a lot of times when somebody comes in with back pain, they're able to fix it before they go out.
They do a lot of workers' comp, so they have more of...
They have direct line for that patient to come in and be able to see them immediately after that injury, which is cool.
Which is a huge difference between dealing with something that just happened, an injury that just happened, compared to an injury that's been going on for months and months and months. The rehabilitation part of that is completely different. And you can get better effects the sooner you see your therapist after an injury.
Mm-hmm.
So,
what else?
There's people that work in skilled nursing facilities, and that's just getting them up and moving.
Sometimes they treat skilled nursing as some they do rehab, but they aren't required to 3 hours. Sometimes they'll get an hour a day, sometimes less. They lost a lot of money, skilled nursing, towards their therapy. Is just the way billing works. It's terrible, so it's tough there. What's next?
We got women's health. That's a whole topic that a lot of people don't even know exists. Anything from pre-birthing to birthing to post
and
birth, with pelvic floor strengthening, with working on incontinence.
I'm just gonna sit over here by myself. I don't know anything about this. Yeah. Practice your Kegels. That's all I can say.
It's just a very amazing field that a lot of people don't know about and should know more about. And we will in the future talk more about women's health.
Yeah, we got somebody that's awesome at it. That's what we're gonna do an interview with. We'll get that lined up and shoot any questions.
Yeah.
And speaking of that, subscribe to this channel so that you can get notified when we do that. There you go.
And so we're going to keep going. There's aquatic therapy.
That's fun.
There's aquatic therapy within orthopedics, outpatient, and it's just another tool in their toolbox. Or there's people that actually specialize in aquatic therapy, and that's all they do. They're in the water, they're in the pool, and they can do miracles,
Yeah, I saw somebody pop somebody's back in the pool. I don't know how they did it. It's pretty cool. They use water noodles and stuff like that, and they kind of twisted a person around. Rock on.
But it's out there,
And then they do the water aerobics too. That was kind of fun. We did that during PT school and jumped around in the water.
And the best thing about aquatic therapy is that you get to do things in the pool that you typically normally can't do out on land because either pain or stroke or any sort of...
I was just thinking about that one time. A guy we worked with, he was always straight arrow and really smart guy, but he accidentally got the patient in the pool with their chair. They had an electric chair. It's like an electric chair. And went in the pool. He went in after him.
And everything was okay.
And I just thought about that. It's like unloading the patient was really nice that way.
But not with their mechanical chair.
You got to make sure you turn the little electric thing off, the joystick off whenever he gets the patient up in those things and out of them.
Okay. And then there's wound care.
Not me. Not it.
I think it's pretty interesting,
It's
but
cool,
I never did it.
I did it. Well, I did it for a day. We had to do it at PT school, and I went downtown Austin, and there was some scary stuff. People walked in there. The guy had a hole in his stomach you could put a basketball in. Oof. And he walked in. They unpacked that thing, and then I've worked on a farm. I've seen some nasty stuff. That was nasty. And I couldn't work in wound care.
But wound care, it is, it's interesting.
It's a specialty.
It is a specialty. Yeah. That is very special.
Yeah.
But to see...
We need to interview Karen Gibbs, or Dr. Gibbs from school. She had a smell for every wound. It was like a food. They made a whole list of it. It was awesome. We did interview her.
Yeah. And it would be cool to see like the changes, and it changes it happens so fast.
It's crazy. Yeah.
Going from something like open where you put a basketball in it
In my alley.
to those healing processes where the body just heals itself, and then at the end you're like, okay, hippotherapy.
What? Like the hippos?
Like doing therapy for hippos? No.
They're scary. They're dangerous. They're very dangerous animals.
I know. It's actually working with horses.
Oh, did you know that's like a Greek or Roman or some type of word for horse? Is a
hippo?
Yeah.
That's why I have them
Latin,
on this
maybe.
channel.
I don't know. I have to ask my son. He's crazy about Latin.
For random smart facts. But hippotherapy is with horses and correlates a lot more with pediatrics and like kids with cerebral palsy or autism. It's something about the movement of the horse that just helps them relax their joints and their muscles, and they get to have fun in the process.
John's place has that big old arena behind their house that they do that in.
Yeah,
that's pretty cool.
It's like I went to a camp with kids with cerebral palsy, and they did a lot of hippotherapy, and pretty amazing to see. And these kids
just hippotherapy is like aquatic therapy because they get in the water with the hippos, but they don't do that. They ride in the arena. The horses have to be really special too, because you don't want no. I mean, they have to be super chill horses, and
and horses read every emotion.
Oh yeah, they're like really big, cool dogs.
And and they can just be in tune with the kid, and it's pretty awesome to see.
Mm-hmm.
All right, we have cardiac rehab. That's just
that's tough.
Post cabbage,
cardiac rehab is tough. I mean,
it's a specific.
You gotta know your stuff. You better be friends with your nurses because they can tell you if you can treat them or not. It's kind of like working in ICU. It's just that's a very specialized field, and it's important to get up and move around after that kind of stuff, because if not, you're just gonna have blood pooling around.
It's important to move around in the safety conditions.
Being monitored the entire time.
Mm-hmm.
That you got a lot of lines and tubes hanging off you whenever you're trying to get those people moving. Anywhere from a heart monitor to a Foley bag hanging off you while you're doing that kind of stuff. Super fun.
All right. So you have amputees, and that is when someone loses a limb.
Yep. Upper extremity, lower extremity, half a foot.
And that can go through pediatrics to geriatrics to outpatient.
Yeah, it could be different reasons. You lose it because you were blown up in Iraq, or you lose it because you had diabetes.
Either way, like it's out there, and each person's different.
Well, we had a lady who lost all 4 limbs.
Oh, and she was an awesome character.
She rocked it, yeah. I mean, people lose limbs because of burns. I mean, we've seen a lot of those, yeah.
Yeah.
And
car accidents, anything.
And you can go anywhere from just trying to get them to learn how to transfer from a bed to a chair to running. So there's a big wide spectrum through all that.
Mm-hmm. And then another specialty is spinal cord injury.
Before we do that. Let's go ahead and do the orthopedic one we did. We did the orthopedic where we did the limb salvage.
So we did the not amputees. We worked with the little amputees, but we did more of the limb salvage, which was trying to save their limb.
Yep. Trying to see if they could tolerate
after an injury, and then we used a device, the IDEO,
Intrepid Dynamic Exoskeletal Orthotic. And that what we did, we were trying to save like people that, I mean, how much does the military spend just on somebody to get through basic training? I don't even know. And then how much do they spend on somebody to get through infantry? And then you go to Rangers, and then you go to Special Forces. You got everything you can think of. And so we were training guys that were probably worth a few $1 million. And that guy they get shot, they get blown up, and it's one leg injured. We were able to save their leg, and they were able to go, a bunch of them were able to get back out and deploy a few times.
And that was the goal. That was the goal to get back to duty.
Yeah. The lower extremity, that tibia is the most injured bone during the war. That's the thing that came back the most. And now people are coming back a whole lot faster because they have the medic. Literally, they have the medic right there on field, and then they send them to a hospital. Like, they can be there within hours. It's crazy how fast they could save. They save a lot more. Back in the day, people just die. Now these guys are being saved and they're coming back really, really fast.
Yeah. And this isn't one that a lot of therapists work with, because it's
just two of us and then Ralston. That's about it.
and a few other people.
Yeah.
But it's a very specialized. It's kind of an unknown thing.
Yeah. You don't know how cool we are.
Yeah, we're cool. Okay, so we have spinal cord injuries, and people really specialize just in spinal cord, because each level, if it's complete or incomplete, it all depends on what your function, and it can go from, the less function you have, that's the higher the injury is on the spinal cord, and on your spine, and vice versa. Like, the more function you have, the lower.
Yeah, I don't even know
the injury.
Absolutely. But I don't even know where to start with spinal cord. I just work on balance. Because when I start doing it, it's so tough. I mean, because there's so many things you got to watch out for. What is it called when their legs start shaking? I can't even remember what it's called. If we can't remember, we'll cut that out. But
well, I mean, they have all the reflexes, and then it's just
I don't know
the spinal cord is, the body is amazing, and then when you injure it on a certain level of the spinal cord, that can affect so many different things below that level.
Just look at. Do you have brain injury on there?
No, but
that's a stroke. But brain injury is another realm. And
not necessarily just a stroke, but it could be.
Well, a stroke is a brain injury, but then you have a traumatic brain injury. And that's that. I mean, you got psych involved with that.
Well,
to try to learn how to walk again. I mean, it's a lot. It's a lot to deal with those, and you are one heck of a therapist if you're doing those. That's tough.
Yeah, patience and the way you communicate.
The knowledge you have to know.
Yeah, you just have to be very specific with your treatment, and that is when the 3 different therapies do work really, really well together. You have the speech therapy that works on cognition as well as speech, and also swallowing, and they do so much more than most people even think of. And then occupational therapy is working on those fine motor skills, everything that you do when you wake up. You bathe, groom, dress, shave, everything. They work on all those little fine motors, and then physical therapy they do the walking, the transfers, and all of them together make for a perfect environment.
Yeah, everybody hates a speech therapist if they're patients. I always say that, because the speech therapist will tell you when you're wrong. He's like, nope, you got that date wrong. Nope, you're wrong about that. But then a physical therapist, occupational therapist, is like, all right, you button the button. And then the speech therapist is like, no, wrong. You need to interview Casey.
Yeah, we will. But it's
Yeah, there's at Texas Neuro Rehab. We did that rotation there at PT school. And it was cool. They did occupational therapists and physical therapists treated at the same time.
I think that's very
really
important.
Cool. Yeah, that was really cool when they did. And I'm sure there's points, obviously, the physical therapists didn't need to be there, like if they're shaving and stuff, but they got on the mat together and they worked a lot.
Because you're working on, core balance as well as, moving.
Yep. Doing
intrinsic.
Absolutely.
Movement, yeah. Okay, let's look. So now we have bariatrics. I'm not familiar with it, but it is.
I mean, they were doing that at Warm Springs there, and at one point.
They have bariatric chambers for wound healing.
Mm-hmm. Because once you get
what is bariatric?
Yeah, BMI over 50, I believe, right? And then we literally had people that were 500 pounds or more come in, and you have a whole lot more to deal with when you have that kind of weight. Lots of wounds you're dealing with.
And the healing process is slower because of everything else that's going on.
Yeah, so. And it's hard for them. Imagine getting up and I couldn't imagine carrying 400 extra pounds on me.
Well, and your joints are only meant to hold a certain capacity.
Until things
start breaking down.
Yeah.
But all right, we talked about the ICU and ER. Big thing about both of those is that you're dealing with a lot of lines and tubes.
Mm-hmm.
You have to know where the patient's positioned, where everything else is positioned,
What
and when
monitor you can unplug.
yeah, and you're it's like big on vitals and
Yeah.
making sure everything is
You
okay.
move a little bit and sit there.
Yeah, and so that's
a nightmare.
it's like a
Yeah,
Tetris
that's tough,
like
yeah.
game.
Well, once you do it a million times, I mean, they
Like
go
you
in there
know
and
it,
start
you know
grabbing
exactly
stuff,
where it is. All right, and we're gonna talk about
yeah, limb salvage is on there. All right.
yeah, but it's
And then there's people
spot.
that's okay. Other things physical therapists do. There's some people that literally just do modalities, and what that is, I mean, hot pack, cold pack, electric, E-stim, and then there's blood flow
Massage.
restriction. There's massage. There's dry needling.
Yeah, there's a
acupuncture.
whole new realm of modalities.
Yeah.
Yeah,
Blood flow
there's
restriction is really cool. We try to get Johnny or Ben on the interview podcast for that.
mm-hmm. Yeah, and this is kind of we're not going to be touching on every single
We
one
try. I
of
don't know what
these.
all we got. Yeah.
We'll see. Maybe it'll come along. But we do know a lot of people within these specialty realms that will know a lot more information than we know. We know a little information about a lot of things, and then we know a lot of information on
some little
ones. So this is, I
Jack
mean,
of all trade,
our
master of
goal
some.
is just to give information out.
Yeah. Yeah. What's the?
And if we're not the best ones to give the information, we'll find the best people to give it
we know
to.
some good people.
Okay.
So then we got the non-clinical physical
Yeah,
therapist. That's
so-
what I was.
So yeah, I mean, at one point. So yeah, you have people that want to treat the patient, and they love being there, helping and doing everything they can for the patient. Sometimes it gets overwhelming, and
Sometimes
it gets
you just get bored like me. I got
or
ADD when it
or
comes to
you
anything.
get burnt out. Whatever it is. There's other aspects that you can be involved in and use your degree for.
Yep, I did. So I did a couple years of marketing for rehab, and you go out and interview patients, interview their families, and respond it back to the docs over at the rehab center I was at, and see if they're a good fit. That was pretty cool. And then you also go out to local clinics and hospitals and let them know that we're available to treat their patient whenever they needed if that patient needed 3 hours of therapy.
Yeah.
Other thing, that's marketing. Other marketing would be like literally you're working for anything. You see them at the booths all the time when you go to when you go places. Like they're at the booth with talking about their clinic, talking about rehab.
That and like equipment that are used in surgeries,
Mhm.
like Stryker or
that's
anything like that. I mean, you can just be a part of that marketing team, and you go out and you market a
Was it
certain
surgery.
yeah. Another thing you can do is, I mean, there's a whole place where research is there. Like, if you don't like treating patients, if you don't like people, if you don't, if you like numbers and you want to.
Well, they still do some treatment because Johnny just put something on there. Johnny Owens put something saying they're still doing at Fort Sam. They're still doing the same thing. Part of research I was in.
Well,
I
that's
did
great,
research
yeah.
before, and so they were doing. He had an opening there at Fort Sam. There's 2 openings I think for physical therapists because they have to do blood flow restriction and they're doing treatment.
And we're going to talk about blood flow restriction in a whole different.
Yeah, well, you can Google it, but
Session.
we'll go over it more.
Yeah.
What else? What else
We
do you do
have
non-clinical?
a friend that does auditing. She's able to stay at home with her kiddos and
Good money in it.
and do auditing. Yeah,
That would be a tough job. I felt like that's what I was doing sometimes when I was trying to do the inpatient rehab marketing, because I had to look at their insurance and making sure they're able to be treated there. Because a lot of times you can't the insurance won't pay for this.
right. Yeah, you have to know all of that and
then we were, and that's so auditing. They're working for an insurance company, right? And they audit everything. Pretty much is what it is. And then Travis, we were just talking to him. He's doing something tech-wise. He's looking.
well, he's looking into it.
Like whenever, like the whole note thing they're doing, he's going to be like evaluating like the note. I guess that's what it was. That's what he was telling us. So we need to ask him about that and see if we can talk to him about what that all entails.
Yeah, yeah. And then you can be like a director of therapy. You can kind of go up in the chain and
Yeah.
is CEO of.
Yeah, CEO of the rehab we worked at
Rehab,
was a physical therapist.
So it's kind of endless on what you can do. And then
I remember I asked him. He's the CEO of our thing, and I told him, "Oh yeah, Hillary's a great therapist." And I told him like, "Well, she loves to do this and talking about orthopedic." He's like, "Don't tell me. I don't know, man." He's like, "I went from PT school to director of a clinic to CEO."
But that's that's your cup of tea,
that was his route,
and that's completely fine.
Yeah, that's why I'm here doing this, because I've done a lot of stuff, and this is a lot more fun for me.
Yeah. And then you can always be a professor and teach, and there's probably a lot of professors that also treat, because you kind of need both.
And then they do a lot of research.
You need the clinical side as well as you need the clinical side to be able to teach.
Yeah.
So this is just kind of our little.
What is a physical therapist?
What is a physical therapist?
What do they do?
And hopefully people don't just be like, "Oh, you do massage. Oh, are you a chiropractor?
My neck hurts."
And it's just like we that's a part of what we can do, and that same with the chiro. We don't do exactly what they do, but we can, but it's just a small realm of what physical therapy can do.
Oh yeah.
I mean, we were brainstorming, and we just kept on going and going. So we're going to have a lot of information out there for you. And if you specifically want to talk about something, or want us to talk about something, or find someone who's really good at talking about that subject,
tell them to let us know.
Yeah, make a comment below.
We'll make you famous.
Yeah. And then make sure you please subscribe and like our channel.
And there's a little bell. I think it's over here. A little bell down in this area. Hit that bell, and that way you're notified whenever we
have a new video out or anything like that.
And you can follow me on Facebook. We don't have family acreage. I guess I'll make a family acreage health and wellness page on Facebook. I'll just do that. But look for Wayne Struby or Hilary Struby, and then there's just family acreage. But that's for our land selling business.
Yeah.
But if you follow one of us on Facebook, you can friend us if you want. But if you get on there, I post it on Facebook all the time. We really don't do Instagram and
we're
TikTok.
We're gonna try to start posting it.
But you can also go to Odyssey is another way, places. And then there's Float. So the Float.app, FLOTE.app, and then there's Odyssey. We're posting on there too, and try to follow those. Some people don't like YouTube, so whatever's your cup of tea, right?
Yeah, just keep posted. We're gonna be talking about joint replacements, post-operative care.
That's next.
Yeah. So if you have any questions, like I said,
one question was from Trish.
Put on the comments below.
Yeah, Trish said that she wanted to know about ACL, whether or not she need to get one.
So we'll talk about that next one, please. Okay. All right. Thank you for listening.
Bye.
See you later. Bye.